If you suffer from migraine headaches, pay attention.
Oh, yeah, this is really critical news. Thanks for joining us, Dr. Ahluwalia. So a lot of times the medicine that people have to take when they have these severe migraines gets them nauseous, and that's almost just as bad, right? So there's a new thing?
Right. So Lisa, it's important to know that almost 10% of the population worldwide has some migraine-affected issues, right? And half of those people have nausea.
Okay.
So now you're having this intense headache, you can barely function, but you're also nauseated. We can't give you a pill, it's not going to work. You won't be able to keep it down, right?
Yeah.
So the FDA has just approved this transdermal patch that you can apply on the skin, and it allows the medicine to go through your skin to treat the nausea.
So it avoids the stomach area.
It avoids the stomach. And I think for migraine sufferers, this is a big deal because so far they've been, you know, if you're nauseated, you can't really take care of your symptoms. Okay. But I think with this, it's going to be something new and it's going to be something really valuable.
Also something that is being looked at, the American Cancer Society is saying that for smokers, if you're a smoker, you need to get a CT scan, right?
Well, it's not really you need to get a CT scan, but what, you know, cancer is the leading, lung cancer is the leading cause of cancer deaths worldwide. So we're trying to see what we can do to reduce those deaths. What we found, and the American Cancer Association has said, is that if you've smoked for 30 pack years, that means the number of packs multiplied by the number of years you've smoked, within the last 15 years, it may be worthwhile for you to get an annual spiral CT. A spiral CT is a low-dose CT, which has a fifth of the radiation, and it may be able to catch cancers to save maybe a fifth of the lives that would have been lost from the cancer.
So you could get treatment ahead of time, almost like getting a mammogram then?
Correct, similar to that, but we always have to keep in mind that any kind of testing always leads to false positives, right? Okay. And so they also found that of all the people they were screening, approximately 40% of them had an abnormal CT scan, went ahead to have tests, and perhaps some people lost their lives because of the unnecessary testing. So don't just get the scan, but talk to your doctor because this may be something valuable.
Okay. And then one last little bit is the whole issue of Ambien, and now we're needing to reduce the dose for some people?
We think that the dose may be too high, especially for women. You know, we give this for a good night's sleep, but what we're finding is that perhaps it's working even the next day. So maybe people are driving impaired, maybe people are working impaired, and we need to reduce the dose of this Ambien. So keep in mind, if you're taking Ambien, talk to your doctor. You may need a lower dose.
And especially if you're a woman.
Yes.
Dr. Ahluwalia, thank you, Steve. I know certainly when I used to do the early mornings, I would anchor on Ambien. Not a good thing.
Perhaps a better show.
But it was fun because it had nothing to do with the news. You just got out there and blabbered.
Yes.
It's the good stuff.